So my name is Nikkhah, and I'm a consultant plastic and reconstructive surgeon based at the Royal Free. I specialize in microvascular surgery and also breast reconstruction. DIEP flap is an operation that we perform for breast reconstruction. It's essentially a tissue transplant. We take the lower abdomen with its blood supply and use that to reconstruct the breast after mastectomy. Most of our reconstructions, plastic surgeons work alongside breast surgeons who perform the mastectomy, and we do the reconstruction either with the DIEP flap or an implant. DIEP flap, though, has certain advantages because it provides like-for-like reconstruction. The breast tissue will feel soft, unlike an implant. Also, it's much more radio-resistant compared to an implant. So an implant-based reconstruction will suffer quite greatly after radiotherapy. DIEP flap doesn't. It is a longer operation, but we found from studies published by our group and other groups that in terms of long-term, patients have less problems in terms of revisions and issues with the reconstruction. It really is a workhorse reconstruction at the Royal Free, and we do nearly 200 microsurgical reconstructions a year for the breast. I think women choose it because it is a much more natural form of reconstruction. It feels like their native tissues. It's safe in terms of there's no associated risks in terms of having problems with capsules or very rare complications such as lymphoma that can happen with implant-based reconstruction. It's also, as it's a tissue transplant from your own tissues, we found that patients in the long run have less problems with revisions. A lot of the patients that we performed implant-based reconstruction on, they will need to have their implants revised or changed at the long run. That's avoided in DIEP flap, and that's why we find it is the gold standard in reconstruction. It's not suitable in every patient, but I think it has certain advantages over implant-based reconstruction. In terms of microsurgical reconstruction, we've got a very well-oiled service that's been running a long time over the last decade, but we offer one-to-one nursing, a high standard of care for all the patients. All our reconstructions, flap reconstructions, are done with a dual consultant approach, so 2 plastic surgeons and 1 breast surgeon. So we find that improves operative efficiency, reduces the risk of takebacks, and also tissue transplant failure. So we're quite unique in that. We also use up-to-date techniques for flap monitoring. We've also use a device called indocyanine green, which monitors skin flaps, and few centers actually in the UK use this, but we've been using this for the last 5 years.